Hey guys, welcome back to Medical Coding with Blue. It is Christmas in July, day 4. Now, this is also 4th of July, so happy birthday, America. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. This Christmas in July season, I am sharing stories about myself, growing as a medical coder, and just stories that are personal to me. So I hope that you all enjoy this very candid look at myself and my life. And so let's get started. Today's episode, I am going to be talking about my very first day working at a hospital as a medical coder. Now, I did my other video on my very first day on the job as a medical coder, but I was working in a freestanding clinic when I did that. So this is more in line with what I'm doing today, which is working in a hospital. I work in a hospital currently. And so this first job as a medical coder that's working in a hospital, I was actually considered a contractor because I was going through a temporary agency to get this assignment. And I am now a permanent employee of the hospital that I work at now. But back then, I was still considered a contractor. So my very first day, there was a couple of other ladies that were starting as well. And they were also going through temporary agencies. And they were there, so it was nice to not be the only new person. So getting there, the very first thing they had us do was get our badges. So we took our picture and we filled out some more paperwork for the hospital that was specific to the hospital. Because again, the temporary agency has all of our information, but the hospital needs a record of all the employees for their information. So we did spend a good amount of time there doing that. So then we had a meeting with the supervisors so that we could get nailed down the details of what we were going to be doing. So what they had asked us was if we had any preference on the location that we like to work, did we have any prior experience? So I did tell them that I had worked for the Cancer Therapy Research Center, so I was confident in that, but I was willing to go anywhere. So they liked that. Then they were asking us what hours we would like to work, because in this facility, there was a lot of flexibility when it came to hours. So I said, well, what hours do you have available? So they said, we are here 7 days a week. So if you want to work on the weekends and you want to work part way through the week, that is totally fine. And so they said some people work Sunday through Thursday. And I'm like, that's fine with me. I am totally fine with working Sunday through Thursday. And they're like, really? And I'm like, yes. They go, most people don't want to work that schedule. And I go, no, I'm fine with working Sunday through Thursday, because in my head, I was like, okay, if I get off of work on Thursday, I can fly home and be home Friday, Saturday, and then fly back on Sunday. And the bonus part of working on a Sunday was that you could pick your hours. So they said that I didn't have to show up to on my normal schedule. Like if I wanted to work from 7 to 3:30, I didn't have to show up at 7 o'clock on a Sunday. I could show up anytime I wanted to, as long as I got my 8 hours in. So I was like, oh, well, I could do that. Because that made it even better. I could always fly back. In my head, I'm already calculating this stuff, right? So in the morning, I could always fly back and then start my day, at noon or 1 o'clock. And I was totally fine with that. So that worked out really well. And so they said, you're going to be training with us for a whole week, and then you'll be able to start doing that schedule that you like. So I'm like, okay, that's great. So then the ladies scheduled their schedules, and then we got issued our books. So we all got an ICD-9 book, because it was ICD-9 times back then. Then we got a CPT book, and we got a Hicks-Picks book, and we got a abbreviations book. They did give us one. So I was like, okay, cool. I got all these nice new books. And so we had to schlep them, around with us, because we still had to, go to a few other meetings that day. And then we left our books in this one office, and they gave us a tour of the hospital. So at least we knew where we were going. And this hospital had an amazing cafeteria. Now, I know a lot of people talk trash about hospital cafeterias, but this hospital cafeteria was amazing. They had the most amazing breakfast. They had the most amazing lunches. And when I worked on the weekends, they had the most amazing dinners. So, but anyway, getting back to the story, I was looking at this big, huge hospital because it's like 11 or 12 floors. I can't remember if it's 11 or 12 floors. I need to probably look that up. But I remember thinking, gosh, this is where I'm working now. This is, all these people. And then you see these doctors that are walking around in the hallway. You see these nurses. And they're, of course, looking at us because we're brand new. And everybody can spot somebody that's brand new, right? And they said that they were going to, once we got done with this training week, because the training week was devoted to learning how to use their electronic health record, how to use the encoder, because I had never used an encoder before this. And a couple of the other ladies didn't know how to use the encoder as well. So it was nice that I'm trying to not to sneeze, guys. I'm sorry. The other ladies didn't know how to use the encoder either, which the encoder is very easy to use. And if you have never used an encoder, I do have an encoder demonstration video up. I will probably try to link it in this video. Anyway, so that was what the whole first week was devoted to, was, learning all their systems and making sure we understood how to use their punch in and punch out system, because we had to log into a system in order to punch in, and then we had to punch out for the day. But for our lunch breaks, we had to send an email to our supervisor and tell her that we were out, and then when we were coming back. So that was just a safety measure on their part, because we were contractors and they wanted to make sure that we were working when we were supposed to be working. So I was fine with it, I was totally cool with it. And so they had us in this training office. We were working in this office. It was more like a conference room for that whole week, but they did have computers in there. So that was nice. So that way we could get that one-on-one training and things like that. So it was very nice to be able to transition in where they were accustomed to training people. And so that was what was so good about this facility, was they were used to it. And this was a teaching facility too, so there was a lot of that going on. So I think everybody, the culture of working there, they all understood that. And they told us that we could wear scrubs if we wanted to. So I was like, okay, well, I guess I'll get scrubs then. And if you haven't seen my video on the scrubs, I did do a video on that and how it is important to dress for the part that you want. And so for me, it was nice in the beginning, but now that I know and I've been around long enough to understand the importance of presenting yourself well, especially in a professional environment, it goes a long way. I did learn a lot at this facility. I wasn't there very long because if you've been with my channel for a while, you know my journey, and I was there for less than a year. I was only there for 8 months, and then I was off to my place that I'm at right now. Which that will be on another story, another story time. But for me, working in this place, it was amazing. They had they said we had to get parking passes for our vehicles. So we also did that in the first week. And they gave us a sticker to put on our vehicles, so that way, we could just, be safe wherever we were parking at. And the employees had their own parking, and then like patients and everybody else had their own parking. So for us to be able to park where we needed to park, we had those little stickers. So I thought that was neat. But it was just a matter of getting into a routine. And then after that very first week of all of that training, and then they just sort of turned us loose to doing what we were assigned to do, which is, for me, I was working in the pro fee side, right? I was working for the professional fee services. And when a provider goes to visit a patient that is staying in the hospital, they have to get paid for their services. So that's what I coded. So it is inpatient, but outpatient. So that's why a lot of people didn't want to do it, because they said it was too difficult. And for me, when it was explained to me, it wasn't difficult. And being a brand new coder, really only 3 months in, I was like, okay, well, I don't know to be scared, because I've never done this. I'm scared now of everything at that moment, right? Because it's like you're brand new and you're nervous. It was more nervous than scared, right? And so that's where I was in my head. I was like, okay, I'm already nervous, but I'm just gonna go with this because this is something new. And so after that first week, and then I was able to start working on Sunday, and I could work anytime I wanted to, and I was like, "Ooh!" And so that's what I did, and it worked out very well. I was very comfortable with that schedule, and I liked the way that it worked out because I didn't have to be there Friday. I certainly didn't have to be there on Saturday, and so it just was very nice. And then working on Sundays, there was nobody there in the facility, so it was nice and quiet, and I could just work in peace. Because the rest of the time, we're in this room all together, and it was just like, okay, so there's a lot of noise, and so, but it was nice to just start fresh and new, and I could start my week that way, and working those quiet times on Sunday was just amazing, and I really enjoyed it. So, but yes, that was my experience working in a hospital for the very first time. It was very nice to be able to be in a place that they said, well, we have this wonderful cafeteria that you can go there for lunch or wherever, and it was open all the time. So it wasn't like where it would close and then it would open. It was just open all the time. So, you could go there if you wanted to go on a break, or, if you wanted to have your lunch there, or you could stay, at your desk and eat there. So that's what I did. A lot of times that's what I did. Sometimes I would go out into like the picnic tables, because they had really nice picnic tables set up, which I have to say I was very impressed with that. That they always tried to make it like it's very homely there, like really comfortable. And working in the basement though which was where I worked for the beginning part of my stay here. I did eventually get my own office, and it was up on the 7th or 8th floor. I can't remember now. It may have been the 8th floor, I think. But I did get my own office after a while, and that was really cool. I'm going to have to do another video about that. But I get inspiration as I'm talking. It was nice. I will say that. And it was really good to have an amazing supervisor like I did. And like I said, I consider Jessica to be one of my very closest friends to this day. She is the one person that I will call if I ever have a question about coding, because as you'll learn in your career, that not everybody's experience is the same. And for some people, they do things in a way that it's always been done. With Jessica, what I noticed about her, and what I definitely liked about her, was that she always questioned everything, and she always reviewed things, and she's so good at a coding clinic. She knows that there's a coding clinic for this and coding clinic for that. She knows. So because of her, I believe that I've learned so much, and it's made me a stronger coder because of that. So I always admire her for that, and I'm very thankful that she was there in that first part of my journey to help me along. And I'm thankful for her friendship to this day. So, but anyway, that was my experience, and I'm going to go ahead and wrap this one up. Thank you guys so much for joining me, and I will see y'all tomorrow for Christmas in July, day 5. All right, I will see y'all next time. Bye.